And it's a great pleasure to introduce Michael Hurley, who's a wonderful person and a tireless, dedicated individual with a long history of serious advocacy for the public interest. A hospital worker and a CUPE member since '77, he's fought for 4 decades in the public interest as president of the Ontario Council of Hospital Unions since 1990, the first vice president of CUPE Ontario, as well as regional vice president on CUPE's National Executive Board for Ontario. And he's a writer and a thoughtful advocate, and I've learned a great deal from Michael. So over to you, Michael. Thank you.
Thank you so much, Nancy and Natalie, and it's a real honor to be on the panel tonight, and particularly to be in the company of so many outstanding community and provincial activists, all of the people who are on this brainstorming session tonight to talk about what we can do together around the threat to public health care in Ontario. You know, I think the really groundbreaking work on the problems with private care were done by P.J. Devereaux, Dr. P.J. Devereaux and Gordon Guyatt and others about 20 years ago, when they studied death rates in for-profit hospitals and not-for-profit hospitals, and for-profit dialysis and not-for-profit dialysis. And what they found was that in the public hospitals, they had a death rate that was 2% lower than the private hospitals. It may not seem like a lot, but when you think that these hospital systems might see 10 million people a year, you know, you get a sense of the scale. And on the private dialysis clinics, the death rates were 8% higher. In the case of the private dialysis clinics, the reason the death rates were 8% higher was that, among other things, which included, you know, not using registered, regulated staff, the owners sometimes watered down the dialysis cleaning fluids, the blood cleaning fluids, to maximize profits. In the case of the hospitals, the profits of 10 to 15% a year, the taxable status of these institutions, the enormous compensation for the people who administer these for these companies were all pinned as reasons why the staffing levels were so much lower and the death rates were so much higher. Now, that was 20 years ago, and you might think that that's outdated, but when we look back at what happened just a year ago in Ontario, we have to acknowledge that there couldn't be a more poignant case for the heartbreaking tragedy that is the private delivery of care than the 4,000 residents in long-term care who died during the pandemic. And they died, you know, the death rates, you know, Southbridge lost 9% of its residents, Rica lost 8.6, Sienna lost 6.5, Rivera lost 6.3, Chartwell lost 4.6. The average loss in the for-profits was 5.2 residents per 100 beds. And the not-for-profits lost 2.8, and the municipal homes lost 1.4. Municipal homes lost 1.4 because, of course, municipalities are investing in additional staff. It's important, I think, to remember, you know, that many of these facilities failed to have really any meaningful infection control processes to protect residents. They continued to cohort people who had COVID together with people who didn't. They refused to transfer them to hospitals if they had COVID because they would have lost revenue. They had no PPE for their staff. People wore garbage bags. They had soiled masks. We redeployed people to a number of these private retirement homes and long-term care facilities where residents were dead on the floor. There were no staff. All of the PPE was under lock and key. These are shameful. And so many residents who didn't die of COVID died of heartbreak. They died of loneliness. You know, they died of malnutrition. They died of dehydration, and yet these companies, you know, not only did they fail to acknowledge the scope of the tragedy, their responsibility for it, their obligation to these human beings, they took millions and millions, tens of millions of dollars in profits out of these facilities, even as the army was occupying them to try to provide life-giving care. That's our reality in Ontario. The fact that this government has gone on to announce an expansion of for-profit long-term care stuns most of us, I think. And obviously, this is something I think that none of us is going to allow to happen without a furious fight. But as Natalie said, when the Minister of Health says that moving from the success that they've had in for-profit delivery of long-term care during the COVID pandemic, they are now, under the guise of the backlog of surgeries and medical procedures, going to move to increase the numbers and funding for private hospitals and independent health facilities in Ontario. This is a point at which we have to say that as citizens, we will not accept the degradation of care. This is all ideological. This is a wealth transfer that's going on. And the people who are bearing the brunt of its impact as society ages and as it grows are the elderly and the people who love them. I mean, that is really who is being turned away for care, who is dying of neglect, who is pushed out of hospital too soon. So we need to make a stand here, I think. We need to make a stand to defend these institutions. And the rest of the country looks to us. They look up to us. We are the largest province. What happens to here is material to the future of Medicare in Canada. And we not only have to push away for-profit delivery of hospitals and in long-term care, but we need to push for an expansion of funding as long as we're facing the demographic challenges we have, so that there is a quality to the care, a meaningfulness to the care, and so that people's care needs can actually honestly be met. And there isn't a group of activists in this country that is as well positioned with your community networks and your community activism and all of the hard work that you've been doing throughout the pandemic to raise these issues. There isn't another group that is as well positioned as you are, as we are collectively, to push this government back. This government is not on track to be re-elected with a majority. All three political parties, as I hope we'll hear tonight, disagree with them on this question. We are going to mount a furious defense of public health care in Ontario, and we're going to embark on that, starting with the action plan we do tonight. Real honor to be here. Thanks so much.